So I'll just finish off here. This one's kind of a little bit of a summary. Somebody wrote it to us a little bit over a week ago. So how our feelings about the coronavirus may be different now than they were a week ago, or they may be kind of the same, or more elaborated, or who knows what. Okay, but she covered a lot of the different things that people may be feeling. So I thought I would just comment on that because I think it's important that we all know whatever we're feeling, other people are feeling it too. And whatever we're thinking, other people are thinking it too. And so we're not kind of all alone in this whole thing. And I think one of the things that's coming across so strongly, everybody keeps saying we're all in this together. And it really keeps coming across we are all in this together. Yeah, not only in experiencing the shutdown and the economic things and concern about the people we care about and concern about getting sick ourselves. Not only those things, but also how are we going to come out of this? When are we going to know that the lockdown can stop? Okay. Now, certain government officials may say, Easter, that's kind of been dropped, thank goodness. But some people are expecting, because now it goes until the end of April, maybe May 1st, But how are we going to know that it's safe? Because we don't have widespread testing to see who is carrying the virus, who still might infect other people. And I don't even know if there's any plan from the government to do that kind of testing to see. There hasn't been any sign of that so far. Yeah, but it seems like we need to have some assurance that it's not just, okay, we get up on Monday morning and everybody goes to work just like they did before, and that's it, and everybody, their work is just, waiting on their desk for them, just like, for the Friday before, and everybody knows what to do, and they'll just get back to work, and then that'll be Monday, and then Tuesday the economy will boom, and the stock market will go up, and we'll forget about all of this. Yeah. So there doesn't seem to be much of a plan for coming out of all of this, just as there hasn't been much of a plan for going into it. Yeah. What it may be is how we come out, going into it, coming out of it, is we hopefully will see how much we depend on each other. Yeah. And hopefully Americans will coalesce. And, in the future, when we have this kind of thing, we will have a national stockpile of resources that can be deployed to all of the states instead of everybody competing with each other to buy scarce things, making the prices go up. But so hopefully we will have learned something about that. Hopefully we would learn something about helping the most vulnerable amongst us. Yeah, because it's just coming out now that, the Congress made this last thing of sending out checks to everybody. They wanted to do it very quickly, so they didn't, go into a lot of details about things. And as a result, a lot of people who really need the stimulus the most are not qualified to get it. Okay? For example, immigrants who do not have a social security number. Okay, legal immigrants, yeah, they don't have it. Same with green card holders. You can get it if you have a social security number, but not if you don't. Some of the people on disability, if their family claims them as a dependent, they don't get the money, and their family also doesn't get the money. For families with children under 17, they get $500 for each child. But if you have a child 17 and older, and you're claiming that child as a deduction on your income tax, you don't get any money for the child, and the child doesn't get any money either. So this is a lot of college students. Yeah. So, we can see that there's a lot of people who really need the money who aren't going to have access to it. And I didn't even mention people who are working very hard but do not have legal status here. Yeah. Who are so many of the healthcare workers taking care of everybody who's sick. But hopefully we will learn from this kind of thing to have a better social network system, so that people, when they run into difficulties, aren't going to find themselves on the street or, in such anxious situations. Okay. So hopefully that's something we can learn from this, and hopefully come together as a country. I don't know if any of you saw Queen Elizabeth talk yesterday. Yeah, it was so good. She was, she was very queen-like. Okay, so she's not like me and waving hands and, but very queen-like and everything. But she gave such a beautiful talk to people about coming together, and the Britons have this experience of being strong and going through difficulties and coming out the other side, and we're going to do this. And it was this beautiful, encouraging talk. And you really saw from it what it means to be a good leader in times of crisis, or just a good leader in general. How she spoke in ways that brought people together and gave them encouragement. So hopefully, somebody can give us something like that here that might bring this country together, and resolve this partisanship that has really been destroying the country and destroying our American institutions. So hopefully, maybe we will learn something from this too, and learn to come together. Okay, so let me read what she said here. Okay, so most people's daily routines and interactions have shifted significantly. Yeah, and that's really true. I mean, little kids want to go to parks, the parks are closed. Yeah, the other day I talked to some people in Hong Kong, and they were saying how much they appreciate now just being able to go out as a family and have a meal together. Yeah, because can't do that. Restaurants are closed. Yeah, so just simple things that people used to be able to do, maybe now they're learning to appreciate. And initially, this feeling of disruption was there, but maybe now some appreciation is coming. Okay, there are many examples of kindness and support, examples of growth and community connection, and a sharing of vulnerability. And that's really true. I mean, if you look at the papers, just New York asked for more doctors and nurses and other healthcare workers. I can't remember how many, it was thousands of people, some who are New Yorkers, some people from out of state who volunteered to go there and work in the hospitals and take care of people. And that's incredible. Yeah. And then people being kind to neighbors and, uh, you know, people having babies and then bringing the baby to the old folks' home to show grandma and grandpa through the glass, you know? And just things like this that are really bringing people together, and these acts of kindness that, that we're experiencing. And here too, I mean, the number of people writing us and asking if we're okay and sending care packages. It's so touching. Okay. There's also fear, loss, and discomfort. Okay, for sure, because there's change. And here is where we really have an opportunity to learn and to watch how our mind works, how we like predictability. Okay, and how as soon as something changes, we feel like we're floating and we want to grab something. And it brings fear, it brings anxiety. Yeah. And we don't like change. But we do like the change that we want to have. We don't like the change that just comes to us without permission. But when we want to change something, we like that change. So it's so interesting to see the mind, as soon as we want something like change, fine, it's great, let's change this ASAP. But as soon as we can't control a situation and we don't give permission for the change, but the change happens, then we feel really insecure and fearful. But what a time this is to relax and to realize how little we can control. And so how much better it is, rather than getting tense and fearful, how much more productive we are when we accept the situation and then do what we possibly can to improve it, instead of clinging on to our old ideas. Okay, so it's really a chance to work with our minds and just like, okay, I can't control, but what can I do in this situation that benefits other people? And how can I create the causes for the kind of future that I want to have, not only personally, but the kind of future I want our society to have? How can I create those causes? Because if you want to control anything, the time to control it is at the time of creating the causes for it. Yeah, because if we create the causes, then those effects will come. If we don't create the causes, those effects will not come. The time to exercise control is not when the effects are there or coming, because the causes are already ripening. Yeah. So to really make us think about karma a lot, and to bring that into the present, and okay, the kind of control I have is to, be kinder now, be more generous now, be more tolerant and patient and compassionate now. Yeah. And that will create the cause for our harmonious society, and to not be in a society where we have a pandemic and social upheaval and so on. Because what causes those things? Non-virtue. Yeah. We found it in the Wheel of Sharp Weapons, didn't it? What's the cause of this kind of thing? Non-virtue, the 10 non-virtues. So if we don't want to experience pandemics and epidemics and so forth, what do we need to do? Abandon non-virtue, create virtue. Yeah, it's right there. And this is the kind of stuff that we can do now because we're at the causal stage. Yeah. Okay. So she's also saying it's bringing to the fore of my mind all the Buddhist teachings, interdependence in a really obvious way. Okay. Because we really depend on each other a lot now. Impermanence, how suddenly this happened. Yeah, we had warning, but we just spaced out. And, the disease is on the other side of the world. They've talked about pandemics before. It's never really hit here. So this will be the same. Yeah. And how, we disregard the teachings on impermanence and we ignore the teachings on karma and its effects too. So this is a really good chance to kind of wisen up, yeah, and take this kind of stuff more seriously. Okay, so she says, my experience now directly reflects the teachings and the things I thought I understood, but now I am sure is an opportunity for practice. Yeah? I am trying to be mindful at this time, to watch my fears and ask questions as they come up, like, what kind of a horror story is my mind creating at this moment? Yeah. And why is the horror story always about me and the people around me? How come it's not for everybody? And what would happen if I released my own horror story? Okay. And so she says, I am currently, extremely grateful for my circumstances and following the stay-at-home guidelines. I have a job, house, companionship, some small ability to help others, and the Dharma. I'm able to be in contact with friends and family around the world and talk with people on the phone or via video. So having time to do that is very precious. Yeah, so it is a time, really, I think, when a lot of people are seeing how much they cherish other people and yet don't express their fondness and affection and cherishing to those people. Yeah. And so it's a time when people, I think, are getting in touch also with people that maybe they haven't been in touch with for a while, and said and expressed their fondness to those people that they haven't expressed it to. So that's all good stuff, isn't it? Yeah. Okay, so it depends how we take any situation. And here we have an opportunity to really take it and deal with it in a very compassionate, wise way that will bring good results.